All right, we're going to do this in two segments. I want to make a special appreciative announcement first. Today, we received a generous donation of 25,000 masks to the City of Houston, adding to the 10,000 the George H.W. Bush Foundation for U.S.-China Relations donated last week, and a gift from our friends in China. These masks will support our Masked Up campaign and will go to Houston's vulnerable communities. The Bush family, and today I'm standing with Neil Bush. Neil, let me just thank you. Really appreciate the generosity. The Bush family is an integral part of the Houston community. And time again, they step up with their hometown when their hometown needs them, and we value their generous donation at a time when our city is dealing with a public health crisis. We are thankful and grateful to the Bush-China Foundation's Coronavirus Action Network partners for securing these much-needed masks to ensure those who need a mask may get them. And it's ironic, this is the first day where we are all mandated to wear some sort of face coverings. We also thank our friends in China and look forward to continuing our long and positive relationship. It's my pleasure to welcome Neil Bush to come forward and say a few words. Neil.
Thank you, Mayor Turner, Mayor Pro Tem, and city officials for your leadership, and thanks to the city employees that are keeping our city going, to the fire, police, municipal. Thank you all for your service. My father advocated for closer ties between China and the United States for years. He knew that we have far more in common than what divides us. When China was going through the peak of the coronavirus, the Bush-China Foundation found sponsors and sent desperately needed supplies from Mexico to China. That's what Americans do. We help others in need. As the pandemic hit the United States, many Chinese friends have sent thoughtful messages, and some have gotten together to send supplies. And the Bush-China Foundation is distributing these supplies through our Coronavirus Action Network. As of today, we've given close to 100,000 masks to area agencies, including the 35,000 masks to the City of Houston that the mayor referenced, for the mayor's team to deploy as part of the health equity response and the Mask Up program. By the way, from March 1st through April 8th, for about a 5-week period, there have been over 525 million masks, 195 million gloves imported from China. China continues to be a reliable trading partner for our country during this time of need. Infectious diseases know no borders. To fight this pandemic, to get our city and our country going again, it is critical that people from across the globe find our common humanity, that we lock arms, and that we work together. This mandate can be seen today by the generosity of Chinese friends who care about our city's well-being. And for that kindness, we at the Bush-China Foundation are most grateful. Thank you again, Mayor, for your leadership.
I want to thank Neil, and I will tell you the gift is very timely since Thursday of last week in preparation for the Masked Up campaign and the fact that people have been asked to wear some form of facial covering. The members of City Council, Mayor Pro Tem Dave Martin, and all of the other council members have collectively, we've come together, and since Thursday, I think we have distributed more than 66,000 masks already. And between now and next week, weekend, for example, more than 200,000 masks will be distributed to meet the to give out to our vulnerable communities in our city. So the gift is very timely, and Neil, thanks again. Look forward to continuing to partner with you. Okay, thank you. Okay. Okay, we're going to segue now to a second part, and Chief Acevedo, Chief Pena, Dr. Purse. Let me just say there's a lot to cover, in this press announcement. In addition to the announcement that we just made, I know the governor just finished making his announcement indicating that the stay-at-home order will be lifted at the end of this month as of the end of April the 30th. I had a chance to listen to him, as I'm sure most of us did. And so with respect to, I think, retail stores, restaurants, movie theaters, malls will be open at a 25% occupancy level. Then depending on the results from that, on May 18th, it could go to 50%. And then with respect to museums, sole proprietors, church and worship services, sporting events were limited to number 4. I guess like tennis matches or playing golf. Those things also will be allowed as of May the 1st. And he indicated that his order will supersede across the state, and no local orders can be any more stringent than the orders that he put in place. Let me make a few comments, and let me just say that it is my hope that with the measures that are being put in place, that our numbers will not spike. That is my hope. I know that there are a number of people in the conversation in the last week and a half, the last 10 days, have been about reopening our economy. And I fully understand the need and the desire to reopen. It has always been the intent of all of us here locally to do things based on the advice we've been getting from our medical professionals, the data, the science, to make the best decisions possible in the best interest of the people that we serve. And so the governor's pronouncement today pretty much will take these measures, the ability to stay-at-home orders and things of that nature, out of our hands locally, and he has pretty much established the timeline and those things that will take place and how they will proceed. It's my hope that opening up, like he is proposing, will work. It's my hope, because I do know we do want to get our economy back up and going. We also want to make sure that our healthcare needs are not hurt at the same time. Let me simply voice just a cautionary note in the sense that there is no vaccine that is available for us right now. And I think what we can all agree, and I think the governor acknowledged, is that what we have been doing in the state of Texas, in Houston, Harris County, those measures have been working. And I think we can agree that the stay-home orders, for example, working, the closing, the rescheduling of many of our conferences and conventions have worked. The social distancing, the wearing of face coverings, they have worked. But the virus is still here. The numbers are favorable in terms of people coming into our hospitals and people going out of our hospitals, the availability of ICU beds, availability of ventilators. Those numbers are good. But I will tell you, today the Houston Health Department is reporting 74 new cases of COVID-19 and bringing the total case count in the city of Houston to 3,358. And sadly, the number of deaths has increased to 46. That means that 4 people have lost their lives to this particular virus and are being added to that death count. Yesterday, the number stood at 42. Today, the number is 46. The 4 new deaths include a Hispanic male in his 50s with no known underlying health conditions, who passed away on April 17th. A white Hispanic female in her 80s with underlying health conditions, who passed away on April the 9th. A white non-Hispanic female in her 70s with underlying health conditions, who passed away on April 19th. And a white non-Hispanic male in his 70s with underlying health conditions, who passed away on April 21st. And so let me just say this. I know the numbers are favorable, but every day almost we are adding to the number of people testing positively for COVID-19. And sadly today, we are reporting 4 individuals who have lost their lives to this coronavirus. The maximum that the city of Houston has ever reported in one day has been 5. And so today we're adding 4. And so I want to emphasize, as steps were being taken to reopen, I simply want to put forth a cautionary note that the virus is still prevalent and there are still things that we need to do. The key to stopping the community spread of the coronavirus in our city is in our practice in social distancing, good hygiene, wearing face coverings, which became, of course, mandatory in Harris County today, and testing. But as we said, as it relates to face covering, though they are mandated as of today in the city of Houston, we will be providing masks or face coverings over any sort of citation. So if you run into someone in a uniform like Chief Aceveda, he's not going to give you a ticket. He'll offer you a mask. And so that's what we're emphasizing, because it's all about your health. I am pleased to announce that earlier today in the city of Houston, we opened a new testing site at Barnett Sports Complex in Southeast Houston. Because as was indicated today, the governor's announcement about opening, what is very, very important is the testing that becomes critically important. That determines where this virus is and how prevalent it is and whether or not we're getting our arms around this virus. So it's the testing for the city of Houston that we will continue to focus on and place a great deal of emphasis on. And I know people want to open up. I got that. I understand that. But let me tell you, what drives me as the mayor of the city of Houston at this point in time, and it cannot be better emphasized than this. Local cases more prevalent in at-risk neighborhoods. This is what, as mayor of the city of Houston, this is what drives me. And this is what is important. And in many ways for me, it's personal. Because when you were born and reared in a community like this, when you operated on the margins, when you didn't have access to health care, for me, this is personal. And I know people want to open up. I got that. But many of the people who live in these communities, these are individuals who are serving the tables, and these are the people who are riding the bus, or riding light rail, working on the front line, and what they are asking for is not necessarily when we are going to open, but Mayor, tell me, what are you going to do to keep us safe? And as long as these are the headlines that's on the front pages of paper like the Houston Chronicle, this is what I want to hear about. This is what I want people to speak to. Not gloss over it like it's not important, because it is. Because for decades, these people have lived on the margins. And they suffered through the tax day flood in our city. They suffered through Hurricane Harvey. They suffered through Tropical Storm Imelda. And now they're dealing with this virus. And the reality is, as much as we would like to say, as I heard a few minutes ago, we are out of the range of COVID-19. We are not. We're not out of the range. Not when these type of articles are still being written based on the facts that exist within the data. And this is what we have to address. And you just can't ignore it. And so I was pleased to announce that earlier today in the city of Houston, we opened a new testing site at Barnett Sports Complex in Southeast Houston. And that was done in partnership with United Memorial Medical Center, UMMC. It will provide free testing to people with or without symptoms and can do up to 250 tests daily. And beginning tomorrow, we will expand our testing capacity even further. The Houston Health Department is bringing COVID-19 testing to vulnerable communities through new mobile testing and partnerships with community organizations. I see Dr. Purse. Is Director Williams here? Okay. On Tuesday, the Health Department will begin offering free COVID-19 testing through its mobile unit at strategic multi-service centers. People do not need to have symptoms or appointments to be tested. The mobile unit has a daily capacity of 100 tests and is available as a drive-through or walk-up option. Mobile testing will occur Tuesday through Fridays from 10 a.m. to 4 p.m. and Saturdays from 10 a.m. to 2 p.m. or until capacity is reached at the following locations. April 28th through May the 2nd, the Kashmere Multi-Service Center, 4802 Lockwood Drive. That's April 28th through May the 2nd. Kashmere Multi-Service Center, 4802 Lockwood Drive. May 5th through the 9th, we will be at the Hiram Clarke Multi-Service Center at 3810 West Fuqua. May 5th through the 9th, Hiram Clarke Multi-Service Center, 3810 West Fuqua. May 12th through the 16th, we will be at the 3rd Ward Multi-Service Center at 3611 Ennis Street, May the 12th through the 16th. And people with questions about mobile testing can call the Health Department's COVID-19 call center at 832-393-4220. More testing will give a better indication of the impact this virus is having on Houstonians and ultimately help stop the spread. As the focus statewide turns more to opening businesses, and the governor, of course, has announced his plan, it will be important for us to know how we can send people back to work in a safe and responsible way. I know the governor also spoke about contact tracing and the testing. I'll leave it up to Dr. Purse to speak to that. I'm not quite familiar with where the contact tracing is taking place inside the city of Houston. And lastly, I want to thank the Houston Muslim community for practicing social distancing during this important time of Ramadan. I know circumstances are different this year, but it is important that we remain healthy. And I want to end today by briefly acknowledging the passing of someone who was a part of my daily COVID-19 briefings for as long as I can remember. You cannot see him if you are not watching from home, but for weeks, ABC 13 photojournalist Willie Dixon would come to City Hall, set up onto my left on the top level of the media riser to cover the news conferences. And last Friday, he was also out at our mass distribution. Before he covered the daily coronavirus updates, he covered all the major sporting events and traveled the world with some of our top reporters and anchors to bring us the news. Willie passed away far too soon over the weekend, and I want to extend my deepest condolences to his wife, to his daughters and colleagues at Channel 13. Now let me yield to Dr. Purse.
Thank you, Mayor. As the Mayor pointed out, we had added more cases today and tragically more deaths. And so one thing I want to point out is to remind everyone that as we move forward, that in public health, there is almost always about a 2-week lag between when an intervention occurs and when you see the effect in the numbers. And so I just want to remind folks of that. The other thing I want to point out, I want to discuss a little bit today is we mentioned last Friday about the new nursing home project that the health department is engaged in, and I mentioned on Friday, but that actually began, not on Friday, began back on April 3rd when the Houston Health Department engaged with CETRAC, the Southeast Texas Regional Advisory Council, in a regional webinar for all nursing homes throughout a 25-county region to get them acquainted with and facilitate their understanding of the new CDC guidelines, which, by the way, have come out in 2 versions since this whole thing began, to make sure that the nursing homes were understanding of those guidelines and the nuances within them, and especially when the changes occur, to make sure that we brought their attention to those. Since that time, there's about 100 of the classic nursing homes in the city limits of Houston. We've been in touch, we've been calling them, we've been in touch directly with over 50 of them that we reached out to, and others called us and asked for help, and so we've been guiding them over the phone. On Friday, we began our new program where the health department sent teams, and our plan will be to hit each of the not only 100 nursing homes, but the additional 200-plus long-term care and senior living centers. And we're doing that in conjunction and partnership with our colleagues from the Houston Fire Department who provided the manpower for us, because simply that's a large number of locations to visit, and we needed a bigger army to do it with. And so our friends in the Fire Department, who are frequent visitors to nursing homes in their line of work as EMS professionals, and there's already a relationship there, so that is facilitated. So again, like on Friday, thank you, Chief Pena, for your support with that. We have, within our nursing homes, we've got 177 COVID positive cases. I can't tell you out of how many nursing home occupants there are, we'll get that, but we know of 177 COVID positive cases across 21 different facilities. 12 of them have 3 or less cases, and we're working with them. Over the weekend, we went out on Friday, Saturday, Sunday. We have teams out again today. I've talked with those teams, and their findings is that for the most part, the nursing homes are actually doing a really good job of trying to contain the virus, but there's a large number, 177, and that just underscores this virus's ability to spread in a very stealth-like manner. And so as we move forward, we need to remember that, and remember that the things that the mayor has been talking about and we've been promoting from a public health standpoint of social distancing, wearing your mask, washing your hands, covering your cough, staying home when you're ill. As we move forward, we have to redouble those efforts if we don't want to run into trouble in the short time.
Thank you, Dr. Burton. Chief Pena.
Thank you, Mayor. Thank you, Mayor. Good afternoon. I'd like to first start by also offering my condolences to the Dixon family for their terrible loss, and also to the Channel 13 family for their loss. He will be sorely missed. I want to reiterate what Dr. Peirce has mentioned. The fire department has participated in a task force with the health department to go out and visit the nursing homes in our region. The goal, again, is prevention and containment of the virus. And as the focus turns to opening up businesses here in the state, the fire department is preparing with their contingency plan with the anticipation that we will see a rise in infections. And it's our firefighters, our paramedics that are going to go out there and treat these people. So we're trying to get ahead of it as far as containment and disinfecting at our stations. This week we started with our decon groups who will be going out to every one of the stations, 100 stations throughout the city, to provide a deep cleaning and a deep decontamination of these stations. And the goal, again, is to ensure that we are not having community spread within our fire stations. Because it is a concern, as the mayor's passionate comments here, we do anticipate that the number of exposures, the number of calls for people suffering from this virus is going to rise, and we have to do what we need to do to prepare and take care of our firefighter safety. To this point, we've had 39 firefighters have tested positive for COVID-19. 26 of those have since returned back to work. We've tested a total of 116 firefighters throughout the course of this operation. 72 results have been received, and we're still waiting on 44. We have 68 currently firefighters, 68 in quarantine, and they're all recovering safely at home. That's my report for now. Thank you.
Thank you, Mayor. And thank you, Mayor Pro Tem, both of you, for always being up here with us and for your leadership. I want to start off, first of all, by, again, expressing my condolences for Willie. He was just an amazing human being, and I think it's indication of just how fragile life is. And regardless of what is required or not required, decency shouldn't be legislated. We shouldn't have the governor or anyone else tell us what to do to keep each other safe. And as we open up, I can just tell you on behalf of the men and women of the Houston Police Department that people will continue to exercise, like the mayor is saying, social distancing, good hygiene, wearing of masks. We know that on the USS Roosevelt, a good percentage of the folks were asymptomatic, but there were carriers, and we know that while some people may not ever see anything, have any impact from getting COVID-19, too many of our fellow Americans die from it. And we have one of our officers right now, Ray Cervantes, who continues to fight for his life. He continues to need our prayers. He's still on a ventilator. He still has a lot of fight left in him, but he's not out of the woods, and we're just asking for people to continue to pray for Ray and his family, and we ask for people to think about Ray and his family and other families that have already lost a loved one in this, and those that we want to prevent by exercising just common decency. And please continue to wear masks, exercise social distancing, and just be respectful of one another, because the last we want to do is see people die, and we don't want to shut down our economy again. Let me just give an update briefly on our status, operational status. First, we've had a total of 189 members of the Houston Police Department that have been tested for COVID-19. We've had 42 positives. Our sworn have been 179 tested and 40 positive. And our 10 civilians have been tested with 2 positive. To date, out of the 42 positive, 29 folks, 28 uniformed and 1 civilian have come back to work, and we're very happy for that, but we still have one, again, that's fighting for his life. We're starting to see, Mayor, that our calls for service are now up. We had seen a slight flattening of the calls for service, but the calls for service are now up. Daily average in terms of homicides has gone up now post-COVID. But like I've said before, and I'll say it again, I am proud of our men and women that despite this challenging time with an invisible enemy, they're out doing their jobs. They're chasing bad guys. They're making arrests. Felony and misdemeanor arrests are up. So both felony and misdemeanor Class A and Class B arrests are up, which just shows you the commitment of our men and women. Not to mention, again, we're dealing with an uptick, continued uptick in domestic violence and a continued uptick in the burglary of buildings. But we believe that will start tapering off with some of these businesses that have been shut opening up. But again, we're fully operational. We are deploying extra resources. And if I just could, because the media will ask, yesterday we had that option-involved shooting, just real briefly. We have determined from aerial footage from the shooting involving that active shooter in the Northeast that one of our patrol officers, he did strike the suspect, and sadly he passed away, but that suspect was shooting up that neighborhood pretty good. So that's my report, and I just wanted to make sure that the media had that update because we weren't sure if it was self-inflicted or if one of our patrol rifles hit him. And with that, Mayor, I'll turn it back to you. Thank you.
Thank you. Chief Buning from the Office of Emergency Management.
Great. Thank you, Mayor, for your leadership and also for your compassion and concern about the most vulnerable people in the community. And I'd like to thank Neil Bush and the George Bush Foundation for donating the masks so the mayor can help fulfill his goal and his wishes of protecting the most vulnerable. I'd also like to give my condolences to the Channel 13 film. I didn't realize that I knew Willie up until they showed where he stood back in the corner there. Like the mayor said, he was up here each and every day with us during the news conferences. The Office of Emergency Management has been busy working and distributing the personal protective equipment to keep the firefighters, the healthcare professionals, and the police officers safe. We're also helping Chief Acevedo get his extra supply of surgical masks so just like the mayor said, they can issue masks instead of citations. This is just another step that the mayor has implemented in keeping the community safe. The Office of Emergency Management is also closely monitoring the storm that's going to be coming in through tonight, because it is expected to hit between 2 a.m. and 5 a.m. Not a whole lot of rain, but some strong winds, maybe 40, 50-mile-an-hour winds. So the Office of Emergency Management will be monitoring all night. We've already been in close contact with the fire department, the police department, and Public Works in the event that we have to come in and take care of some down trees and maybe some block roads. Thank you, Mayor.
I had one last thing, Mr. Mayor. One last thing, we tweeted about this yesterday, I did. Regardless of what the law is, we know that May 1, that the mandatory mask, per the governor's executive order, will not be required across the state. However, it's important for the community to realize that every single business can require you, if they so choose, to wear a mask. So please be aware of that. You don't have a right to go into a market or a Providence business. If they ask you to wear a mask, you must wear the mask. If you fail to leave the premises, you are subject to a criminal trespass warning or a criminal trespass arrest. So please be aware that in this state, property rights are very important, and businesses can require that, whether it's a theater, a supermarket, anywhere. If you're required to wear a mask, please don't get us involved. Just have some common courtesy. And again, Mayor, thank you for the masks, because our first goal will be to issue that mask instead of making an arrest. And one last thing, I got to brag on him, Mayor. Thank you for Dr. Peirce. He has been so wonderful for us, and thank you for giving us the gift of Dr. Peirce. Thank you, sir. Who's the quiet assassin in the back of the room.
And I think, Dr. Peirce, you want to make a comment on the contact tracing?
Yes, sir. Yes, thank you, Mayor. And I neglected to extend my condolences to the Channel 13 family and the family of Mr. Dixon. Tragic loss, very young, very healthy individual. It just shows us how fragile life can be. Mayor, you mentioned earlier about contact tracing. And so the contact tracing is a form of epidemiology. It's a science. People go to school to learn how to do this. And it is like being a medical detective. And so as we get a case, somebody who tests positive, we have to find that person, much like a detective. We have to find them. And very often we're starting very scant information. A name and a phone number sometimes is all we have. We have to find that person, and then we have to interview them and find out the timeline of what, when they got tested, why they got tested, had they had symptoms or not, have they had symptoms since then, and then based on that, try to figure out when, if they were infectious, when that was, and who they may have come in contact with. And you can imagine that's a very difficult thing to do sometimes. If you asked me what I had for lunch yesterday, I'd have to stop and think about it, much less who I had lunch with 3-4 days ago. And so they have to learn the skill of how to get people to jog their memories and recall and sort of pull out of their memory who they were with. Because with the positive cases, that individual needs to be, they need to isolate themselves so that they don't spread the virus. We know that they're infected, they're a positive case. What we don't know is how many people they may have infected. And with this particular virus, with so many people not having symptoms, unfortunately, we have to assume that everyone who they came in contact with is potentially also infected and spreading the virus. And so we then need to reach out and get those folks to ask them to quarantine themselves. And I want to reinforce something which we said earlier at the press conference earlier, is that when I say those things, I fear that people are going to become fearful of getting tested because they're afraid that if they're positive, that then they're going to have to isolate themselves, and then their friends and family may wind up getting, being asked to quarantine. And I say getting asked to quarantine. But here's the thing. The reason to get tested is that if you are positive, you are now empowered to protect your family members. Because if you're positive and you don't know it, you're infecting the people closest to you. That's the ugly truth about this virus. That's why it's caused such a problem, is because people who are well-meaning, feeling totally normal, are spreading the virus completely unknowingly. So every one of us should get tested. We need more testing. You're working on that. But we need more testing so that people can be tested. So that's how we get ahead of the virus. Right now, we're still chasing the virus. We need to turn that around, and we'll do that with people with more testing capacity, people going and getting tested when it's available, and then the contact tracing to try and beat this enemy, which is the virus.
As a contact tracing started here?
So we've been doing contact tracing within the health department. We've been doing it, we do it all year long with other illnesses, but we've been beginning, as soon as we had, well, as you recall, back when the Egyptian river cruise. So we stopped the virus with contact tracing at that point because the folks came back from the Egyptian river cruise and one of them was ill and tested positive. And so in conversation with them, we found that they had been on the cruise, found out the manifest of everyone who had been on that cruise. We contacted all of them, started getting them tested. Many of them were positive, found out who they had been in contact with. And in contact with, I mean had a meal with, lived with, went to work with. We started quarantining those folks after we found out who was positive. And by doing that contact tracing, we stopped the virus from that exposure. Remember, there was one person from Taiwan who joined that group of high school friends on that river cruise, infected everyone, not everyone, but pretty much everyone on that river cruise, and the riverboat crew, who then went on to infect passengers on the next 4 cruises. And so when you think about it, that's just how insidious this virus is, and that's why it's so important that we do the contact tracing. Now, as we move forward, and I think what you're getting is the governor's comments about contact tracing that the state's going to do, and so I don't have any real insight into that. We'll have to wait and see what they mean by that. But as we expand contact tracing, and at this point, we'll take help from wherever because this is going to, the more testing there is, the more positives there will be, the more contact tracing we need to do. So we need an army here of people to do all this contact tracing. And so I don't know specifically what the governor is referring to with that, but I'm hopeful that we're going to find out soon and we could absolutely use the help.
And that's the point I want to make. The contact tracing that's taking place right now is done on the local level, but we certainly would welcome the support from the state or feds or anyone else because contact tracing is very much labor intensive, and so many more resources. With respect to the masks, the face coverings, we're going to be continuing to work through our 16 city council members, Mayor Pro Tem. So we'll be getting masks to you all. And why don't you just, in terms of who they can contact, the city council members, get the mask?
Yes,
Mayor Pro Tem Dave Martin.
and you heard the theme today. We're interested in issuing surgical masks and not citations. So on Friday, every member of city council received thousands of surgical masks. And what we started doing was attacking the most vulnerable communities, as the mayor mentioned, the senior areas, the low socioeconomic areas of a district, the at-risk population, to distribute surgical masks in preparation for today. So contact your council member and make sure that you have the ability to receive a surgical mask because we do not want to issue citations. We want to educate people and we want to keep them healthy. And the way to do this is by being proactive with social distancing and wearing face shields. So contact your local city council member or call my office at 832-393-3008, 832-393-3008, and we'll make that connection for you. So thank you. And appreciate everything that citizens of the city of Houston are doing. The reasons why our numbers look so good is because you listened, and we appreciate that very much. So thank you.
Thanks, Mayor Pro Tem, and again, continue to exercise caution. That's very critical. Just want to say, as we go through these additional steps, please just bear in mind the virus has not left the premises, okay? The virus is still very much in the city of Houston, but the efforts that Houstonians have made have helped to keep our numbers relatively low, and that we're very appreciative on that. So the social distancing remains important. The face coverings remain important. Exercise caution. Let's not engage in what I would call reckless or irresponsible behavior. And then we'll just take it one day at a time as we move forward. I think that should do it for today. And then we'll pick it up real soon. So thank you all so very, very much.